All right, good afternoon, everybody, or rather, good morning. We're going to talk about diabetes, how we're going to control diabetes and live happy. All right, just a little computer trouble here, but we're moving on. First thing we want to talk about is hypoglycemia and hyperglycemia. Anybody know what that means? All right, you over there. Right, hypoglycemia means low blood sugar, hyperglycemia means high blood sugar. Can anybody tell me about the signs and symptoms of hypo and hyperglycemia? Okay, you over there in the pink sweater. Right. So when you have low blood sugar, you can have fatigue, anxiety, shakiness, sweaty, hunger, confusion. Late signs of low blood sugar is seizures, loss of consciousness, definitely a visit to the hospital. All right, hyperglycemia. Early signs are frequent urination, increased thirst, blurred vision, fatigue, and headaches. Late signs would be nausea and vomiting, shortness of breath, confusion, coma, hospital visit. So, how do we avoid these things? Taking care of ourselves. Diabetes is one of those diseases that you can control by simple things, and we'll get into that later on in the presentation. But today we just want to focus on the things that we can do to make our lives better. So, treatment. When you have low blood sugar or high blood sugar, the idea is to treat them fast. You usually know what's going on because you get early warning signs. Treat the early warning signs. If you wake up or, out of nowhere you start to feel cold and clammy needs some candy. That means you have a low blood sugar. High blood sugar, if you're trying to drink everything in sight and you just feel like you can't get enough, that means your blood sugar's high. You need to test and find out what's going on and where you stand. If your blood sugar's entirely too high, you need to, depending on what your orders are, take your sliding scale, call your doctor, maybe even make a visit depending on what's going on. Don't let it get too much higher than what it already is. Diabetic testing and your supplies. You definitely need to make sure you have your supplies. If you don't have the supplies, how can you check your blood sugar? Yeah, you can guess my blood sugar's low or my blood sugar's high, but you'll never get an accurate reading unless you actually test. So here's some things you need to remember. What are your orders? Did the doctor order you to test your blood sugar before your meals? How many times a day are you supposed to test? Do you test your blood sugar when you're sick to find out where you stand? Do you know what's a normal read and what's an abnormal read? Meaning, do you know what the parameters are? Hypoglycemia, anything less than 60. Hyperglycemia, which is high blood sugar, is anything over 150. Are you keeping a recording? You need to keep a diary so at least you know where you stand. And you can compare it when you go to the doctor. What do you do to treat your results? Do you take insulin? Do you take pills? Do you change what you eat? How do you treat it? Your supplies, have they expired? Are they within the expiration date? Yes, supplies do expire. Your test strips expire. Your meter needs to be collaborated. Your alcohol pads expire. And are your supplies compatible? You can't use, let's see, what example can I give you? Your meter is one brand, but then your test strips you borrowed from a friend, and you're going to use those test strips with your meter that aren't compatible. You're going to get an abnormal read if it reads at all. So you need to make sure that you have the proper equipment. And another thing I want to talk to you about when we talk about equipment, do you have any impairments? Are you visually impaired? Are you hearing impaired? Are you even able to test your own blood sugar? There's equipment out there for that. You just have to let your physician know. Diabetic medications. Know your meds, your insulins. How many of you know that your insulin, you have a fast-acting and a long-acting insulin? Okay. Do you know how fast it works? For instance, if you're using your fast-acting insulin, how long before you need to get something to eat? 10 to 15 minutes. That's just with Novolog. However, if you're using regular insulin, you have 30 to 45. If you don't get anything to eat, you're going to go into hypoglycemia, which again is low blood sugar. Then you have your long-acting insulins. When do they peak? Well, Levemir peaks in 8 to 10 hours, whereas Lantus doesn't peak at all. But you still need to make sure you know what your meds are, how often you're supposed to take them, and don't take them outside of your orders. If they're not working for you, that's a conversation you need to have with your doctor. Diabetic diet choices. So here I have posted a few meals. Let's see which ones are good for you and which ones are bad. So you have the tuna with the chips and the soft drink. 1,050 calories with 183 carbs. Definitely not good for you. Yeah, the other picture's not as appealing. You have the berries, and you have a turkey sandwich on wheat bread with it looks like more veggies. So those calories are 445 with only 55 grams of carbs. That's your better choice. Pasta. You need to stay away from pasta. You see this pasta dish has over 2,000 calories with almost 200 carbs, whereas a turkey tenderloin with looks like mashed potatoes and broccoli is only 360 calories with 42 carbs. But look at the serving size. You really need to pay attention to the serving size as well. You need to reduce your carbs and sugars, eat small, frequent meals, definitely read your labels, and reduce your calories. Changing your diet can change your whole diabetic treatment plan. No insulin, maybe oral meds, or no medications at all. Diabetic compliance. How many of you are compliant with your diabetes? Right. Diabetes can basically change your whole lifestyle. But again, managed correctly, diabetes can just be a diagnosis. It does not have to control your life. So some things that you can do: reduce instances of hypo and hyperglycemia. Test your blood sugar as you're ordered. Treat your blood sugar when they're low or high. This also reduces hospitalizations. You don't necessarily have to run back and forth to the hospital if you're compliant with your regimen. Stigma. Stigma has a lot to do with non-compliance. Well, diabetes doesn't have to take over your life. As a matter of fact, when you're diabetic, you need to let people know that you're diabetic. You can wear your identification bands. If something happens and you were to fall out, this could be life or death. They won't think it's a heart attack or a stroke. They'll automatically know to take your blood sugar first. There's also associations out there that can help you. The American Diabetes Association. They have counseling and others in your group who actually feel the same way that you do. You need to join forces, see what you can do, talk with your doctor about your hangups, because there's no excuse for the disease to take over you, your life, and your whole well-being. You can control diabetes. So let's recap. I have a test for you. Let's see how much you paid attention. True or false? To ensure an accurate glucose readings, I should test after meals. False. You should always test your blood sugar before meals. If you test after meals, it's going to be an inaccurate read because you've already eaten a meal. True or false? I can use any type of test strips with my test meter. No. Everything has to be compatible to once again ensure you're getting an accurate read and you're treating yourself appropriately. Hypoglycemia is a glucose level less than 60, true or false? That's true. Anything lower than 60 is hypoglycemia, again, low blood sugar. True or false? Diabetes can be controlled with diet and exercise. Definitely true. You can control diabetes. Novolog and regular insulin are short-acting insulins, true or false? That's true. True or false? I must seek medical attention if my glucose runs greater than 400 and does not decrease with my sliding scale. That is true. You do not want your glucose to go up any higher because that can cause you to go into diabetic ketoacidosis and end up in an ICU or coma. True or false? Rice and noodles are good for diabetic patients. That's false. Rice and noodles are full of carbs, which break down into sugar. True or false? Irritability, anxiety, shakiness, and clammy skins are signs of high blood sugar or hyperglycemia. That's false. These are indicative of low blood sugar. True or false? I must eat 3 large meals a day to help regulate my blood sugars. That is false. You must eat small, frequent meals in small proportions. All right, any questions? All right, thank you for your time.